Hello, this is part 6 on the anatomy of the abdomen. The abdominal pelvic cavity extends from the diaphragm to the bony pelvis. It consists of two parts, which is the abdominal cavity and the pelvic cavity. Something important to note is that the thoracic cavity and the abdominal pelvic cavity are divided by the diaphragm. So anything below the diaphragm is in the abdominal pelvic cavity. The abdominal cavity contains several different organs, which includes the liver, the gallbladder, the pancreas, just to name a few. The pelvic cavity includes the urinary bladder, the rectum, and parts of the reproductive organs. Now, taking a look at the organs, we're looking at the right upper quadrant and what's in those different quadrants. The majority of the liver is in the right upper quadrant. The right colic flexure is in the right upper quadrant. The gallbladder is in the right upper quadrant, and we'll see other organs as well. The left upper quadrant, we can see the pancreas goes across both sides. We won't worry about that, but the spleen is over here in the left upper quadrant, and so is the left colic flexure. In the left lower quadrant, we'll see that we have the sigmoid colon is in the left lower quadrant, and then the cecum and the ascending colon is in the right lower quadrant. The cecum as well as even the appendix. Taking a look here, we can also see that the right and left kidneys would be in the right and left upper quadrants as well. Something to consider there too. They are also in the abdominal cavity, technically in the retroperitoneal cavity. So just to review some things here, looking at some anatomy, the liver is a letter D, that's in the right, mostly in the right upper quadrant. Letter E is the gallbladder, that's in the right upper quadrant. The stomach is in the left upper quadrant, that is letter O. And then over here at F is the going into the duodenum is in the right upper quadrant. And then the the small intestine comes around to where we're at letter S is the entire small intestine. We'll talk about that shortly too. It's partly in the right lower and the left lower quadrants. And then we can see the sigmoid colon here at T, that's in the left lower quadrant, and there's the rectum is in the pelvic area. Here's the cecum at letter I and the appendix at letter J. The ascending colon they did not label is shown here. I'll point out to it here. This is the ascending colon. Here's the right colic flexure is in the right upper quadrant, and there's the left colic flexure is in the left upper quadrant. And here's the transverse colon going across. So taking a look at the parts here, we've got the stomach, like we said, is in the left upper quadrant. That's the portion here. We've got the duodenum, which is in the right upper quadrant. The ileum, which is the part that I'm sorry, the jejunum is meant to say is the part that's in purple over here. That's the mostly in the left lower quadrant. And then the ileum, I-L-E-U-M, that's the area that's in kind of a pink color here. That's mostly in the right lower quadrant. Notice that here's the cecum, and there's the appendix again in the right lower quadrant. So the abdominal pelvic cavity has a peritoneum. A peritoneum is a double-layered membranous sac that's going to enclose the abdominal pelvic cavity. And hopefully you can see in the picture that there's the visceral peritoneum that is going to cover the inner portion of the sac positioned in or over around organs. And then the parietal peritoneum is the outer layer of the sac. In between there, we do have a peritoneal cavity, and that's what it's being shown here is the cavity in this picture up here at the top, is what they're showing is that the space that contains the serous fluid. We have a mesentery and an ommenta that's formed by the peritoneum that supports the viscera in position. And that's shown in the picture here. Here's the picture of the ommenta and the mesentery in both these pictures. So the intraperitoneal organs are completely covered with the visceral peritoneum. Intra means within. That's everything in purple. So everything that we have in purple is intraperitoneal, includes the stomach, the first part of the duodenum, the jejunum, the ileum, ileum, the transverse colon, the sigmoid colon, the liver, the spleen, and it also includes the appendix. The retroperitoneum is going to be something different. That's going to be retro is behind. So it's in the back part, which is the posterior portion, anterior to the spine. It includes the kidneys and the ureters, the suprarenal glands, which are called the adrenal glands, and the rectum. It also includes the aorta, the IVC, the descending and the ascending colon, and then the esophagus. The infraperitoneal organs are located below the peritoneal cavity. And the parts here are the lower rectum, the urinary bladder, and the parts of the reproductive organs. So infra are below. And that's looking at this area down here. Now, if we consider our hypersthenic versus asthenic patient like we did with the chest, the hypersthenic patient is going to have very high organs. They're also going to be very wide organs, meaning that they're going to be wider as far as locations out in the periphery. The gallbladder is high and outside and parallel, and the diaphragm is very, very high in the hypersthenic patient. In the asthenic patient, the diaphragm is very low, and the organs are very long. They're going to be long and also very medially. The diaphragm is the large muscle separating the thoracic from the abdominal cavities. It's very important that we note that any organs that are not in the abdominal cavity are going to be in the thoracic, and the two should not be together. We shouldn't have a hiatal hernia, for example. We have psoas muscles, which is a muscle also. These are large muscles, pyramid-shaped muscles that are bilateral and on either side of the spine. Abdominal quadrants, we've got the right upper quadrant, the left upper quadrant, the right lower, and the left lower, and they're going to the transverse level of the umbilicus and the mid-sagittal plane from the sternum to the pubic symphysis is what we're dealing with the abdominal quadrants, as we talked about earlier. So looking at those quadrants that we have, the right upper quadrant is where we have the liver, the gallbladder, the right colic flexure, the duodenum. Now we head of the pancreas, you can leave off the list kind of. The right kidney and the adrenal gland is important too. The left upper quadrant, keep in mind we have the spleen, the stomach, S and S are on the same side, along with this left colic flexure. The tail of the pancreas, again, I would leave that off. The left kidney and the adrenal gland is also there. In the right lower quadrant, we have the appendix, the cecum, and most of the ileum, ileum. In the left lower quadrant is the sigmoid colon and most of the jejunum. Then you do have 9 regions of the abdomen, which include the epigastrium, the right and left hypochondrium, the umbilical with the right and left laterals, and then the hypogastrium with the right and left inguinals.